removals, extractions, erupted teeth, single tooth, uncomplicated, removals, erupted teeth, complicated, odontectomy, surgical approach, requiring surgical flap, and a sectioning of tooth. Removals, erupted teeth, complicated, requiring elevation of a flap, removal of bone, and sectioning of tooth for removal. Removals, extractions, impactions, requiring incision of overlying soft tissue and removal of the tooth. Removals, impactions involving tissue and a bone coverage. Removals, impaction, incision of overlying soft tissue, unusual difficulties and circumstances. Coronectomy, deliberate vital root retention of unerupted mandibular molar. Coronectomy, deliberate vital root retention to prevent complications associated with extraction. Removals, extractions, residual roots erupted. Removals, extractions, residual roots, soft tissue coverage. Removals, extractions, residual roots, bone tissue coverage. Alveolar bone, preservation, autograft, allograft, xenograft. Surgical exposure, unerupted, uncomplicated, soft tissue coverage. Surgical exposure, complex, hard tissue coverage. Surgical exposure, unerupted tooth with orthodontic attachment. Surgical exposure, unerupted tooth, soft tissue coverage with positioning of attached gingiva. Surgical exposure, unerupted tooth, hard tissue coverage with positioning of attached gingiva. Transplantation of erupted tooth. Transplantation of unerupted tooth. Repositioning, surgical. Enucleation, surgical, unerupted tooth and follicle. Removal of fractured cusp as a separate procedure, not in conjunction with surgical or restorative procedures on the same tooth. Alveoloplasty, bone remodeling of ridge with soft tissue revisions, in conjunction with extractions. Alveoloplasty, not in conjunction with extractions. Remodeling of bone, mylohyoid ridge, genial tubercles remodeling. Excision of bone, nasal spine, torus palatinus, torus mandibularis, unilateral, bilateral. Removal of bone, exostosis, multiply. Reduction of bone, tuberosity, unilateral, bilateral reduction. Augmentation of bone, unilateral, bilateral, pterygomaxillary tuberosity, mandibular ridge. Gingivoplasty and or stomatoplasty, oral surgery, independent procedure. Gingivoplasty in conjunction with tooth removal. Gingivoplasty, excision of vestibular hyperplasia. Gingivoplasty, surgical shaving of papillary hyperplasia of the palate. Gingivoplasty, excision of periodontal gingiva for retained tooth implant. Gingivoplasty, removals tissue hyperplastic, includes the incision of the mucous membrane, the dissection and removal of hyperplastic tissue, the replacing and adapting of the mucous membrane. Gingivoplasty, removal, mucosa, excess, complete removal without dissection. Remodeling, full arch lowering of the floor of the mouth. Remodeling, floor of the mouth, partial arch lowering of the floor of the mouth. Remodeling, floor of the mouth, reincision of the mylohyoid muscle. Vestibuloplasty, submucous. Vestibuloplasty, sulcus deepening and ridge reconstruction. Vestibuloplasty with secondary epithelialization. Vestibuloplasty with labial inverted flap. Vestibuloplasty with skin mucosal graft. Vestibuloplasty with dermal graft, autograft, allograft. Vestibuloplasty with connective tissue for ridge augmentation. Reconstruction, alveolar ridge with autogenous bone, alloplastic material. Extension, mucous fold with secondary epithelialization. Extension, mucous fold with skin, mucous graft. Surgical excisions, tumors, benign, scar tissue, inflammatory or congenital lesions of soft tissue of the oral cavity. Surgical excisions, tumors, benign, bone tissue. Surgical excisions, tumors, malignant, soft tissue, oral cavity. Surgical excisions, tumors, malignant, bone tissue. Selective neck dissection, unilateral, bilateral. Cheiloplasty, lip shave, partial, total. Radical neck dissection, unilateral, bilateral. Hard tissue grafts to the jaw, autograft, allograft, xenograft. Augmentation of the chin, synthetic. Surgical excision, enucleation of cyst, granuloma, odontogenic and non-odontogenic, requiring prior removal of bony tissue and subsequent suture. Surgical excision, marsupialization cyst. Surgical excision, excision of cyst. Surgical incision and drainage, and/or exploration, intraoral, surgical exploration, soft tissue. Surgical incision and drainage, and/or exploration, intraoral, abscess, soft tissue. Surgical incision and drainage, and/or exploration, intraoral abscess, in major anatomical area with drain. Surgical incision, intraoral abscess, hard tissue, trephination, and drainage. Surgical incisions, intraoral, surgical exploration, hard tissue. Surgical incisions, intraoral, abscess, hard tissue, trephination and drainage in major anatomical area. Surgical incision and drainage, extraoral, abscess, superficial, deep and/or surgical exploration, hard tissue. Surgical incision for removal of foreign bodies, removal from skin or subcutaneous alveolar tissue. Surgical incision for removal of foreign bodies, removal of reaction-producing foreign bodies. Surgical incision for removal of foreign bodies, removal of needle from musculoskeletal system. Sequestrectomy for osteomyelitis, intraoral. Sequestrectomy for osteomyelitis. Saucerization. Sequestrectomy for osteomyelitis, non-surgical treatment. Sequestrectomy, extraoral. Mandibulectomy. Total mandibulectomy. Maxillectomy, total maxillectomy. Fractures, treatment of. Fixation, wiring, wiring of dentures or arch bar. Fractures, treatment of. Fixation, wiring, acrylic prosthesis or cup splint. Fractures, treatment of. Fixation, wiring, circumzygomatic wiring, unilateral. Fractures, treatment of. Fixation, wiring, perialveolar or transpalatal wiring. Intramaxillary suspension, wiring, nasal spine, piriform apertures, orbital rim, bilateral, head frame, circummandibular wiring, splints, wires, removal of wire, osteosynthesis without intermaxillary fixation, compression plates, mini plates, leg screws, non-compression small plates, resorbable plates and screws, intermaxillary fixation, bonded brackets, dental wiring, arch bars, cup splints, intermaxillary fixation with osteosynthesis, transosseous wiring, circumferential wiring, external pin fixation, bone clumps, transfixation. Removal of plate or screw used in osteosynthesis. Fractures, reduction, realign, closed, open, single, double, multiple, mandibular. Fractures, reductions, maxillary, horizontal leftots, closed. Fractures, reductions, maxillary, horizontal leftots first, maxillary, open, single, double, multiple. Fractures, reductions, maxillary, horizontal leftots first, compound fracture of maxilla, requiring reduction and soft tissue repair. Fractures, reductions, maxillary, pyramidal leftots second, closed. Removal of plate or screw used in osteosynthesis. Fractures, reductions, maxillary, pyramidal leftots second, open, unilateral, bilateral. Fractures, reductions, naso-orbital, closed, unilateral, bilateral, maxillary. Fractures, reductions, naso-orbital, open, external, sinusal, orbital approaches. Fractures, reductions, naso-orbital, exploration of orbital blowout fracture, and reconstruction with insertion of a subperiosteal implant. Fractures, reduction, malar bone, open, by simple elevation, by osteosynthesis, by sinus approach. Fractures, reduction, malar bone, simple fracture, open reduction with enterostomy and packing. Fractures, reduction, zygomatic arch, intraoral approach, temporal approach. Fractures, reductions, craniofacial disjunction, left third, transverse, closed open. Fractures, reductions, alveolar, debridement, teeth removed. Reduction, alveolar, closed, open, with teeth. Fractures, replantation, avulsed tooth teeth, including splinting. Repositioning of traumatically displaced teeth. Repairs, lacerations, uncomplicated, intraoral, extraoral. Repairs, lacerations, through and through. Repairs, lacerations, complicated, local tissue shifts. Maxillofacial deformities, osteotomy, ostectomy, remius of the mandible, osteotomy, subcondylar, closed. Osteotomy, miscellaneous, osteotomy of the remius of the mandible for destruction, osteogenesis, unilateral, bilateral. Osteotomy, miscellaneous, activation of destruction device. Osteotomy, miscellaneous, removal of destruction device. Osteotomy, maxillary, left first, second, third. Osteotomy, maxillary, closure of cleft fistula, alveolar, palatal. Osteotomy, when interpositional graft is required, using bone, alloplast, cartilage. Osteotomy, when only graft is required for osteotomy, trauma or reconstructive procedures, using bone, alloplast, cartilage. Gynoplasty, sliding, reduction or augmentation. Gynoplasty, myotomy, suprahyoid. Miscellaneous treatment of maxillofacial deformities, corticotomy, interdental septotomy, surgical expansion of the palate. Surgical expansion of alveolar ridge, ridge splitting technique, maxillar mandible. Palatorrhaphy, anterior, posterior, total. Frenectomy, frenoplasty, upper lower labial, lower lingual or Z-plasty with myotomy of genioglossus. Glossectomy, partial, full, anterior posterior wedge. Cleft surgery, primary, secondary, unilateral, bilateral cleft lip repair. Cleft surgery, reconstruction of cleft lip with lip switch flap. Cleft surgery, complex reconstruction or revision of cleft lip. Cleft surgery, closure of alveolar cleft graft. Oral nasal fistula, primary closure at time of initial surgery. Oral nasal fistula, secondary closure with palatal, pharyngeal, tongue, buccal flap. Rigid fixation, rigid internal fixation, using bone, alloplast, cartilage.